Hey, this is DJ Mike from Dance Time in Texas, and you're listening to Lone Star Community Radio on 104.5 KZZWLP Conroe and 106.1 KZCCLP Conroe, and worldwide on irlonestar.com.
At noon. Son, how you doing today?
104.5 and 106.1. That's where you can catch us on the radio, FM, Lone Star Radio Community. I'm doing
Lone
great.
Star Community Radio.
It doesn't matter how you say
we
it, it's
have
still
a
the
wonderful
same.
guest here today, Lonnie Piatt. How you doing, Lonnie?
Great to be here.
So tell everybody a little bit about yourself. Your background.
So my background is I'm a family nurse practitioner by trade, and I specialize in interventional pain medicine utilizing regenerative services. And we do it under a holistic, focused approach. It's a lot. There's a lot in there.
Yeah. Dive into the interventional pain management side of things versus traditional pain management.
So traditional pain medicine is with prescriptions. So you get, a lot of people may have heard of your Oxycontins, your hydrocodones, a lot of opioids, addictive medications that do not solve a problem. They just make you feel good and unfortunately are just not the best option for patients. So interventional pain management is where we want to intervene and what's going on to correct the problem so that you no longer have this pain.
So how, in some cases, would you intervene?
So the good question as far as what do we actually intervene with, I specialize in regenerative medicine. Now that is a spectrum of medicine that focuses on regenerating what's wrong with the body. And I do that through a spectrum of products. Most patients more familiar with platelet-rich plasma. We've been doing that for decades and decades, really kind of hit off the regenerative medicine because it's your patient's blood. So we can draw that blood and concentrate it down, just the growth factors, the great healing properties of it, and then inject it directly where the patient's having a problem, whether it's a joint space or a muscle.
So let me ask you a question. When I hear the term medicine, I'm thinking of a pill. So medicine is not usually just a pill?
Correct. So there's a lot of different forms of medicine. Like I said, I'm a family nurse practitioner. So that's what I was trained in, is traditional medicine, your primary care. Think about your primary care doctor that you would go see. That is the role that I'm trained in. However, after practicing many years for that and realizing we weren't really solving a problem, we were just prescribing pills to help the patient as they went through this, we say manage the disease. But really what we want to do is prevent the disease to begin with, and then when it's actually there, activate your own body to fix the problem, what's going on. Oftentimes we deal with osteoarthritis. Now, osteoarthritis is a big condition that's actually over 30 million Americans suffer from osteoarthritis. So that's your joint pain, your knee pain, your hip pain, your shoulder pain. It's very expensive. Healthcare in America is very expensive. It's about $40 billion just to treat that alone. And that's, your medicines as you're talking about, but also your lost time from work. That's a big concern because of surgeries. There's out of work for months and months. There's a large cost to that. So with regenerative medicine, we want to prevent that from happening. Why replace the knee when we can help regrow that cartilage within the knee at a much cheaper cost to the patient?
That, from not being the medical side of things, when you said cheaper, regenerative, whatever, it grows,
Yep,
rebuild,
yep,
and not replace.
blowing your mind.
It is definitely blowing my mind.
It blows a lot of people's minds.
It's like a lizard getting his tail cut off and it regenerating and growing it back up.
Your body's its own best healer.
Yep. You are correct. There are many things in nature we see. The lizard, great example. You cut the tail off, it grows back. Why? Because it has the ability to regenerate. Our bodies do too. Unfortunately, they don't do it very well. So that's where I come in. I play that part to bridge the gap. So we talked about platelet-rich plasma earlier. Your joints do not have blood flow to them. They're what we say are nutrient poor. So they do degenerate. That cartilage, that beautiful smooth cartilage that helps the knee or the shoulder or the hip move, degenerates and looks more like Swiss cheese over time. We can inject great nutrition in there and reactivate that to where it starts the healing process. And it's a spectrum of different types of injections, not just platelet-rich plasma, which is really our baseline, but also into viable stem cells. We take them from the placenta. Years ago, babies were born from C-section, and we just threw away the placenta because we didn't realize the healing properties that were actually in there. The baby is in a very nutrient-rich environment in that placenta. That's what keeps the baby healthy and prevents a lot of issues in pregnancy. So now a woman has a scheduled C-section, delivers a healthy baby. Instead of throwing away the placenta, there's a donor team that collects the placenta and sends it to a specialized lab to where we can now harness those healing properties and be able to inject that into patients.
Wow. I'm like,
nice, yeah.
no, I'm like, yo, this sounds too much like sci-fi, like unreal, surreal. Harness the placenta, and when did that start anyway? When did you realize that the placenta could be used for something else, to regenerate, to study?
So back in the 80s, unfortunately, medicine, we do the best. We try and help the best that we can, but we were doing some studies. I say we just because I'm part of medicine. It was way before my time. But anyways, we were doing it on fetal cells. It's not a good option. They don't do what we want them to do. They're not safe, and the procurement, meaning how do we get those, is not something ethical. So in America, we said we're not going to do any studies on fetal stem cells. But we still knew that there was these great properties within that. So we started looking at other places. Instead of the actual fetal tissue, what about the placenta? What about the fluid within there? What about the umbilical cord? That is when it all started to say, we know there's a great option, a better option, and that's when it all started, and that's when the research really took off because of the great healing properties within there.
And now, working with patients day to day, month to month, year to year, since you decided to transition into a more holistic point of view in medicine, how would you say that you've been changing people's lives?
We focus on a comprehensive care plan. I'm not a magic needle. I'm not a one shot and you're done and you're healed. You're not going to be 18 afterwards because there's complex tissues around there. So we work with a great team of rehab professionals. We have chiropractors on staff. We have a great organization designed all around not just the joint space that we're rehealing, but all the soft tissues. Because you can't just fix one and not the other, otherwise you're just doing a disservice to the patient. So we combine the best of both worlds so that we can get the best outcome.
Henceforth, holistic.
Yes, we work on whether you're overweight. That's obviously a topic of discussion because every 1 pound overweight that you are, for each step, applies about 4 extra pounds on that joint space. That's per step. You do the math of that, you're looking at about 10. If you say, your average steps per person that's 10 pounds overweight, you're looking at about 20,000 pounds added to that joint space throughout the day.
And that joint space can hold a lot, but it's over time that wears and tears very quickly, correct?
Yep, and that's why we see, and sometimes patients will say, well, it's just I'm getting old. Well, you've had that deterioration in there because the joint space is nutrient poor and slowly deteriorated. But it doesn't mean just because you're old you have to live in a wheelchair or a walker. That's not the normal transition of life. Modern medicine is here to help you and get you active and keep you active. And I run a spectrum of patients, whether it's young athletes, high school athletes, college athletes. I actually have a recent printout of the 40 top pro athletes that have had regenerative medicine. And the list goes on and on. There's famous, whether it's tennis players, Rafael Nadal, basketball players, some big names people would know of, Kobe Bryant, Bartolo Colon, Tiger Woods. Multiple athletes were doing these expensive procedures many years ago, but now it's very cost effective for normal people, just like me and you, Taylor.
It's wonderful. And it's truly... So interventional pain management has been going on for how long?
Interventional pain management has been going on for many decades, but they've utilized steroids to help with pain. And steroids are still used today. About 1 in 5 Americans in the last 3 years have had a steroid injection. That helps with the pain. It's interventional right at the pain site, but it doesn't fix the problem. It brings down some swelling. It brings some comfort to the patient. But the real question is, why was there swelling to begin with?
The cause versus the symptom.
Correct.
So how would you say individuals, when they come in and they talk to you or they hear about interventional or the holistic or the regenerative medicine, how would you say their openness to that is? Is everybody open? What are some, if not, what are some of the common blocks that people might experience when discussing it?
Well, in medicine, one of the common blocks is Google. Everybody, unfortunately, is Googled. Well, I Googled this or I Googled that, and it's understandable, But I went to
pretty
school.
sure I have malaria.
Yeah, exactly. My arm's gonna fall off.
I'm gonna die. Damn, I should not Google it.
That's the rabbit hole,
Yeah.
But we go to school for many, many years for this. It's not a weekend night course that I took. So there's a lot of training and research behind it. And patients, unfortunately, there are bad actors out there. So that's one of the things that I have to fight against, is because there's bad actors. Whether it's a car salesman, there's bad actors there. People dread going to buy a car because of that one or two bad actors. That doesn't mean all car salesmen are bad. It's the same thing with regenerative medicine. Unfortunately, the term stem cell has been thrown out a lot with products that are not true, and patients are just confused. So it's very important when you're looking to get in to have regenerative medicine done, do your research on the provider. Do they specialize only in that, or do they just dabbling in it? And also, how long have they been doing it? I can tell you in the Montgomery area, I've been doing regenerative medicine the longest for a reason. Because we get good results the way we do comprehensive care plans. Like I said, I'm not a magic injection. I'm not, it's not just one and done.
Yeah.
There's a process.
I love that. Whenever because I'm in a similar field in some way, and one of the big things, and when we first met, one of the big things I wanted to know with a lot of people is, okay, when I come to see you, after I work with you, who else am I going to work with?
Yep.
And the fact that you guys do that is huge to me. And I don't, is it huge to other people? Do other people see the appreciation there?
They do. And I have patients that fly in from New York State, Washington State, so much so because we have everything lined up in a good protocol system. And I've actually, I have a side, not only do I treat patients, I also train other practitioners to do what I do. I had a physician a couple months ago from Alabama, a neurologist, who wanted and seen the value in regenerative medicine and wanted to know protocols because they're just not taught in med school. That's not something that they teach you in med school. They teach you traditional medicine, which traditional medicine has its place. But if you want to go above and beyond and do the best for your patients, sometimes you have to search out what's actually the best for them. Because medicine sometimes is driven by insurance. And insurance, not always looking for the best of the patient. They're a business. They're looking, for their bottom dollar, whereas we're looking for the best results for patients.
And puzzles aren't made up of one piece.
Correct.
So I had somebody today that, and this is something that's common for me, and I would assume it'd be common for you, and they said, hey, put your hand on my shoulder. And they took my hand, and they put it on their shoulder, and they raised their arm up and down. They said, you feel all that? I said, yeah, I feel all that. I said, I need surgery, right? I said, I can't tell you if you need surgery. Who told you need surgery? I said, I've been to 6 orthopedists. Every time they put their hand right here and they tell me that I need surgery. How common is that? You see more of these patients than I do.
So my previous experience, I know you know a little bit about my background. I was in the Army for 20 years. So in the Army, we have young, healthy males for the most part doing heavy training. So yeah, I've seen quite a few orthopedic injuries, and orthopedics have been more the mainstay. Even though my background is primary care, I have a very heavy focus in orthopedics. And I can't tell you how many 2-second exams that I've seen that's just like, oh yeah, you need surgery. It's like, okay, maybe they do. Maybe there's something else we can try first. And that's the option I'm trying to bring. It has nothing to do, surgeons are great, they do great jobs at what they do, and they're oftentimes needed. I'm simply saying, hey, let's try something first. Before we jump to something that has risk, even a minuscule risk, let's do something more natural, and let's do something that we have proven results to get you better so that we can hopefully prevent the surgery.
Are there any areas within the body that might be too soon to call for interventional pain management?
No, that is never the case. It's never too soon. So we want to prevent as much as possible, and your outcome is always based upon how early you come and see me. I have a lot of patients that have, gone down the route of, well, I've had probably 20 steroid shots in the last 10 years, and, they said I need to have it replaced. Now that patient has gone down the path and has a significant amount of deterioration. their outcome with working with me is not going to be as good as if they'd have came and seen me many, many years ago. So oftentimes that weight, watch and wait mentality is not good when it comes to your health. When somebody has cancer, they don't watch and wait until they get very sick to go to an oncologist. There's no such thing as a little bit of cancer, just like there's no such thing as a little bit of arthritis. Get it taken care of early, you'll get the best results.
But how do you know when?
When the patient complains of discomfort. So when a patient has any type of discomfort, that tells me that there's a problem. So where's that discomfort at? We go through multiple orthopedic exams. We have x-rays on site. And like I said, with a very heavy orthopedic background, I can diagnose very quickly as far as what tears are going on, how much degeneration is in there, and also get you a care plan of what we can do and explain to you, what we can and can't do to help you. Because that's oftentimes patients. What are your options? They just don't know their options, and we want to be able to fully educate them so they know what their options are.
What's the place for interventional pain management in preventative medicine?
So we do that with health education. So I am a family nurse practitioner by background, and that is where we came into play, because you think about normally as a registered nurse, I was at the bedside helping explain things to patients that just didn't know what was going on in the complex world of healthcare. So with now being a nurse practitioner, not only am I able to treat patients, but I still have that nursing background to be able to explain to patients what's going on and able to talk to them through a good care plan that they can understand and also that they are on board with. We call it health coaching. I can have the best medicine in the world, but if I can't explain it to a patient to where they understand it and are going to follow through, because it's not just things that I do, it's things that they are going to need to do in order to get the best results.
So you guys can help with Parkinson's as well, correct?
There are numerous studies on different applications for viable stem cells. I do not do anything that's under study at this point, only because it's under study. So those options for treatment, or you have to get onto a special board, an investigational board. You had to have clients that you treat with placebos and other services. We're a very small facility. We're not Memorial Hermann. We're not the Methodist. We're not a big facility that has the capabilities to do research like that. So we only practice in tried and true FDA approved treatments.
Before we go any further, I want to say thank you for your service, 20 years in the Army.
Yeah, thank you.
What made you choose field of medicine?
Well, when I went into the Army, I really didn't know what I wanted to do. But unfortunately, it was in peacetime when I came in, it was a while ago, I was going to get out. And then I was going through my resume. I didn't have any skills. And, you come in the Army, low ranking, I could clean a bathroom, I could mow some grass, I could do all that stuff, right? But I knew that wouldn't transfer into the civilian world to be able to do much of anything. So I decided I needed to get an education. The Army was very short on nurses. So they gave me the opportunity to go to nursing school. They paid for it. They sent me to a civilian university, and I loved it. It was amazing, one, to have that opportunity, because I come from a small ranch community in North Texas, and just that opportunity wasn't necessarily there for me. They gave me that opportunity, and I really fell in love with it and continued on with education through there. They sent me back for my master's. I got to treat patients all over the world, in Iraq and in the States, throughout multiple hospitals, multiple different specialties, and just really enjoyed it. Enjoyed being able to treat people.
That's amazing. You're very young. You look young. I could be wrong. You look very young.
I'm getting up there. I'm a
He's
little long in the
young.
tooth.
No, you're young.
Yeah, you're young. So today, with what you do, if you can put it into a few words, why?
Better options
For.
for patients.
Why?
They don't know, and they should know. So it's not that medicine's failed them. I think as providers, we have failed our patients. We get stuck in our, we run off of algorithms. And when I did primary care, you came with a runny nose, I knew what I was doing. You came in with diabetes, we knew what meds you were giving. You had asthma, I knew what meds I was going to give you. And we really didn't reach out and go in depth of what was going on with these patients. They would come in with, cholesterol problems. We'd give them medication. They need the medication, but really they need the education of, hey, eat right, exercise, take control of your health. Because you don't have high blood pressure because I didn't give you a medication. You have it for a reason. And they got me thinking, well, what about orthopedic conditions? There's a reason why their knee hurts. There's a reason why their hip hurts, why they can't lift their arm over their shoulder, or why their wife is complaining she can't grasp her bra or put her bra on properly. There's a reason behind it, and that's why I want to be able to give patients options.
So, quickly, if we can we talk about a few common conditions of the shoulder that you work with, or some of the most common ones? Same thing with the knee, same thing with the back, same thing, so on and so forth?
Yes. So we talk about shoulder. We'll start at the top of the body.
Beautiful.
The shoulder, the Advanced Orthopedic Center in Virginia noted that most middle-aged Americans have rotator cuff tears. Now, we see rotator cuff tears. We talk about the rotator cuff. There's multiple muscles in there, but the rotator cuff is complex, and most people have tears in there. They don't even know they have a tear in their shoulder till it gets to be about 40%. Once it's at 40%, that's when the pain starts. Now, you tell me that it starts at 40%. Well, by the time it starts, what about when it's at 20% or 30%? Why don't we catch it earlier and treat it better and faster to where it doesn't get to that point? But the shoulders, we have rotator cuff tears, we have slap tears, which is a fancy term for a tear in the front of your shoulder, which actually it got famous because a lot of baseball players had it. And it wasn't so much that they were throwing the ball forward, it was they were cocking their arm back with such force they were tearing their shoulder. I see that common with people that are in construction. They're cocking their arm back at such strength, they're tearing the front of their shoulder. It's very painful. You want to lift a kid, you want to lift groceries in a car. It's very difficult, and those muscles, they don't really heal as fast or as appropriately as they should because there's this thing called scar tissue that gets in the way and messes us up. So regenerative medicine not only heals the muscle, but can also clear out some of that scar tissue so you can get full range of motion, great options for the shoulder. When we move down to the hip, we get bursitis, which is pain on the side of the hip. Patients, if they touch the side of their hip and it's tender for them, that's oftentimes is an inflamed bursal sac. That's why we call it bursitis. But we treat that to calm that down. And then, of course, when you have dysfunction of those muscles of the hip, the joint itself deteriorates. And that does it for all joints, and that's that good cap of cartilage that's not solid anymore. It looks like Swiss cheese, and it's encapsulated. So there's no blood flow. It's very nutrient poor. It has a difficult time healing, and that's where we come into play. Same thing with the knee. Now, the knee is very complex as far as we have a lot of soccer players, we have a lot of basketball players because they tear ligaments. Everybody's heard of their ACL, but there's other ligaments in there that also have dysfunction and tears. And the good thing is that they benefit very well and very quickly with regenerative medicine. And once again, it's without surgery. So there's not a downtime in your training. There's not limits as far as that you can't go practice for months and months at a time. We want to get you back out on the field. And that is why we see a transition, because for years, high-end professional athletes have been utilizing these services because they got to get back on the field. It's understandable, but you know what? You got to get back on the field of life. You've got kids, you've got job, you've got career, hobbies, golf, whatever it is you want to do. I'm just here to get you back to doing it.
I love it. And can you go through the 40%, before it gets to 40% in the shoulder, for our audience, can you let them know some things, some signs, some potential symptoms that might indicate, hey, I might need to go see somebody like yourself when things are a little bit lower than 40%? Yeah.
So if you have a twinge, we comb our hair, we have our arm lifted over our head, and we go in a sweeping motion. So with that, patients will note that there's discomfort in there. If you have weakness with your arm stretched out trying to lift something, that is indicative of a rotator cuff tear, or reaching back. Like sometimes you'll have People say, oh, I was reaching back in the car, my car seat, I was buckling it, and that reaching back motion can have some discomfort in there to let you know, hey, I just need to see somebody. Let them check it out. Let a professional look at it and let them say where you're at and then give you your options.
What about the hip?
The hip, we see that with walking. So the hip and knee, those two are really tied together with walking or going up and down stairs. If patients are concerned with twisting because they know it's going to hurt, that would also be a very early indicator that we have an issue. But stairs and walking are really our two big indicators when it comes to knee and hip. If you have to take a break from walking, if you used to walk with your spouse at night for a mile, and now you're only doing half a mile and it's excruciating, let's get it looked at. Let's see where we're at.
One more thing for myself. What has been one of the most complicated hurdles that you've had to overcome during this journey of yours?
We initially started, which was difficult because, insurance doesn't cover some of the specialized treatments that we do. And patients are used to insurance. We've become accustomed to, well, if my insurance doesn't cover it, then, I don't want to pay for it. But you've got to pay for your health. We pay for a car that we trade in every 2 or 3 years, but we don't have the ability to trade in our body. So sometimes it does cost, and that's the unfortunate hurdle, and we work with patients on that hurdle. There's multiple payment options. We're a very small clinic. I don't have, bloated admin staff. It's not a very expensive treatment to begin with, but there is cost involved with some of the treatments. And that's one of the hurdles that we constantly overcome because patients see the value and they realize that they want to get better. So the hurdle is getting easier and easier as people get more and more health conscious.
I like that. Where you have one body and you can't just trade it in. You got to take care of your body. And I'm still blown away where if you have a rotator cuff is torn, you don't have to go get surgery. You can actually regenerate it.
Yep.
That's amazing. That's brand new to me today. And when I hear steroid, people taking steroid, there's different forms of steroids, correct?
Correct.
Can you break it down, the type of steroids that's bad and what's good, what's pain management and stuff like that?
So we look at interventional pain medicine. We do other options for steroids. Now, steroids is just a class of medication. There's multiple ones in there that we've injected, and I've done it in the past at previous practices, whether it's into the knee, a steroid injection into the knee or to the shoulder. It helps with the inflammation, but it causes muscle atrophy. Unfortunately, it lowers your immune system. And if you're diabetic, it just shoots your blood sugar through the roof. So patients are not always a good option for those treatments. That's why we want to give better options for those. Some steroids, now we may think of steroids like a bodybuilder, right, shooting up for those kinds of steroids. Those are not the ones utilized in medicine for pain. Those are a different type of steroids that are just not really utilized. The steroids that we see in traditional medicine for pain are injected into the shoulder, the hips, the knees, and even into the back as well.
Okay. One more question. Surgery is not always the best option. If they go and tear a rotator cuff and get surgery, they're not going to be 100%, right?
Yes,
But if you can regenerate that, would they be back to 100%?
Not necessarily the case. So we run into hurdles. Your body is great, but your body is not perfect. Even with modern science, where we're at, we have a very good outcomes the earlier our patients are seen, but even some of the later patients are still getting phenomenal results. We're still seeing patients that have been years and years with this pain and just kind of trudging along. We're still seeing a good 60-70% decrease in pain, which is still phenomenal because even if they went to surgery, what would their pain relief be? Would it still be in that range or would it not be? That's for a different specialist to say, but I can tell you what I do. Even with patients that are very far along, they're still receiving 60-70% decrease in pain and increased range of motion without the risk of surgery. Surgery, unfortunately, you could get infected, and it's not the surgeon's fault. Surgery is a big option for patients, and they just need to think about it and also know their options.
That's incredible. I got so many people that can...
There's a lot more that we can talk about. We could go on, but unfortunately we have to wrap up. Lonnie, I want to thank you so much for coming on and taking the time today to educate us, to educate our audience and to show not only us but everybody else exactly what a beautiful person that you are, why you got into this. And again, we'd like to thank you not only for your service in the Army, but also for the service that you're doing right now currently for everybody that walks into your office. Thank you so much.
Thanks for having me on.
Let's say where they can find you at, the address and stuff like that.
Back Pain and Joint Center of Texas. We just moved in. We were at our old location for almost 13 years, but we moved into the TransMed building, and that's on the South Loop of 336, and it's 2510. It's brand new, 2-story white building. We share it with multiple other health professionals that are like-minded, holistic providers. We have a gym in there, a compounding pharmacy. We have other great options for healthcare that are like-minded professionals like us. But it's 2510 South Loop 336 right here in Conroe, Texas.
They also have Medical Mondays on social media platforms and Wellness Wednesdays on social media platforms. And if I'm leaving any out, I apologize.
Yes.
That's it, but we're very busy with them.
Very busy with them. So lots of good info to be had there. You can sign up for that and like, share, and subscribe.
Yes, all that good stuff. But thank you again, Lonnie. FNP, again, what does that stand for?
Family Nurse Practitioner,
Family
board
nurse.
certified.
Board. I was going to ask you what BC stand for, but board certified. Thank you.
Yes. Thanks again for having me, guys.
Awesome.
Thanks, Lonnie. Bye, everybody. Hey there, everybody. I'm Taylor Cobion with the OC Wellness in Conroe, Texas, and I'd like to start this off with a question. What's the most important part of your health? That's right, psychology. If your mind isn't in it, then you aren't in it, and that's the biggest part of my job, increasing your drive, energy, and personal happiness. While I'm looking for people experiencing chronic disease, pain, and fatigue, the first step to helping these people, aka you, is by assessing their and your mentality. The information and marketing out there can tend to lead you down a dark rabbit hole, but you've got to remember that your mind and body are what? An original. And you are the what? The captain. Together that's original captain, and that's what the OC stands for. Do you know anyone who visits the chiropractor but still doesn't experience lasting relief? If so, please send them my way. I'm Taylor Cobion, owner of the OC Wellness, reminding you to keep your health and wellness original.
Listen in Mondays at noon to hear Conroe news from local nonprofits, businesses, upcoming events, Conroe Park events, news stories, and information that matters to you with your host, Margie Taylor of Taylorized PR. For more information about being a guest, visit irlonestar.com/Conroe Culture.
Hey y'all, it's DJ Mike from Dance Time in Texas. Join me Monday through Friday at 8 a.m. as I count down the top 10 Texas Red Dirt songs that are packing the dance floor. I'll be featuring local artists and the story behind the hits, shows in the area, as well as new songs that make you want to dance. It's Dance Time in Texas with DJ Mike on Lone Star Community Radio, 104.5 KCZW and 106.1 KZCC, Conroe, Texas, or online, irlonestar.com.
Hey, everybody. Hey. What's going on today?
What's going on, guys? Welcome back to YPC Young Professionals of Conroe 936. We've been out for how long?
I don't know.
2 weeks? Because
5 weeks?
our producer Dick decided to leave downtown Conroe and move up the street to downtown Conroe.
That's far, man. Why do you have to leave downtown Conroe?
He didn't even tell me he was leaving until the day of. And now we're doing our first show
Did
at the
you show up too?
I did.
I showed up.
And they said there's no longer a radio show here. Thank you, Dick.
There's
for
no
letting us
longer
know.
a studio here.
But hey, we're in a temporary studio. Temporary
It's good
studio.
to be back.
That's not a mic. This is the mic.
No.
Temporary studio. It's okay. Hopefully, Dick can get ourselves situated back. In June? In June is when we should have our new office and our new office space and our new radio show and new mics and new camera and new drone and new everything. But besides that, guys, Friday. You trying to punch me in the face?
No. Don't leave me hanging, man.
What is that? Oh, my bad, bro. I'm like, what are you trying to punch me in the face?
Said that's not a mic.
That's not a mic.
It's so good to be back.
It is very good to be back. I'm happy to see you. Wish I could say the same about Dick, but it's okay. 104.5 and 106.1 Friday at noon. Facebook, YouTube.
Sudden link on the
Like,
random.
subscribe. Want to give a big shout out to all our previous guests. Jody, Mayor Jody, Zach Galindo, Levon from Just a Den, Marcos from Douglas
John.
Painted Body. John.
Yeah, John.
No, I'm not. You go ahead. Finish it. John. John who?
H Wheels and Tires, man.
Oh, John and Mike. You forgot his brother. See, I'm like, John who? You got to say John and Mike.
John and Mike.
You can't
I'm
get
sorry.
H Wheels and Tires without John and Mike. Remember, there's no.
Hitting the table.
Damn, don't be yelling.
Don't
at me,
hit the
okay?
table. You're always over here.
I'm pissed off.
So angry.
You
with
can't
your
get
hands.
H Wheels and Tire without John and Mike. You can't
Why
just
you
say
only
John.
naming off men? We've had women guests.
Female.
Yelling too. It's kind of hard to adjust the levels.
Taylor, stop yelling.
I'm a yeller.
Whisper.
I'm loud.
Hey, just welcome back to YPC. We are glad to be back. Our female guest was
Becca, Jade.
Becca Jade,
Who else?
the stencil person.
What was her name?
That was your guess.
What was her name?
I don't know. I don't know.
Journey.
Journey. I'm so sorry, Journey. Please forgive me.
Shame on you.
Shame on him for not letting me know. your
Tara.
name. Tara.
What
From-
about
was
what
it-
about Taco Patron?
Oh, Jessica and her
And?
sister.
Who is?
Don't even look at me. Jessica's sister. Big shout out to Taco Patron. I don't even know her name.
Mike.
Dick.
Nothing. Anyway, we shout out
sorry,
to all
we're
our
sorry,
previous
we're
guests.
sorry,
Did
we're
we
sorry.
shout out to all? We didn't talk about our wives.
My wife, Kelly.
My
his
wife,
wife, Elaine. Oh my goodness, how you gonna forget about them?
How'd you forget?
Unbelievable.
And
Hey,
we're done naming our food.
that's
first.
exactly.
We're
We're done. We're
listing your
done.
name.
I'm gonna tell you
It's okay.
what we got going on. Okay, Friday. Let's start with Friday. Friday at the shop. Tasty Asian. Come Tasty Asian from 12 to 8 p.m. Today from 12 to 8 p.m. Friday. Don't forget that. Saturday we're gonna be out at Main Street Market. Don't forget that we have a market, a farmers market every Saturday from now on.
Every Saturday.
Every Saturday
From when to when?
from 10 a.m. to 2 p.m.
That's a 4-hour window
Guys,
for you to
if
come and get all of your
if you want to
local
be a
goods.
vendor, reach out to Main Street Market and apply to become a vendor because we need more vendors.
You can find all your local needs. Boom,
That's
boom,
it.
boom.
Local needs. We also have the Corner Craving, who also have a market in Conroe. So go check out the Corner's Craving for
What do
that.
they got? What,
Yeah.
Anything that I'm craving?
Everything, whatever you like, they have for you. Yeah, so go check them out. We
Corner
are going to
Craving.
be at Main Street Market, downtown Conroe at 205 Metcalf Street. Tasty Asian will be there, so make sure you go check them out. Also, look out for all the great stuff that's happening in downtown Conroe. We got Fox Beers that's going to be opening up soon. Look out for them. We got Red Brick Tavern, good food and eats. We got 202, great venue. We got Pacific Yard House. Who else we got? We got The Firm. We got Blue Epiphany. We got University of St. Thomas. We got, who else?
Corner Pub,
Corner Pub. Big shout out to Corner Pub. We got who else?
Martin's. They're under construction.
They're under construction. We got great news. Guess what's going to be there?
What's the
It's already in the public ear. Burger and Boudreaux's, or did I say Boudreaux's or Boudreaux's or but I don't know.
Burger and Boudreaux?
No, Burger and
Bordeaux.
Bordeaux.
Yes, Boudreaux is the thing.
I know Burger and Bordeaux.
Burger and Bordeaux.
Is going to be at Martin's Hall. That's the new place right there. So be excited that we have great things coming. And also, was it Brownlee Jewel?
Brownlee Jewelers.
Yes, if you
What about
if
that
you're looking for an
place?
engagement ring, if you're trying to get married, go check out Brownlee
What
Jewelers.
about that place
Don't tap
where
me.
we used to go? The place with all the stuff and the knickknacks for the local people. You know, we used to go do this radio show there.
Main Street Merchant has a sip and shop. The second Thursday or every Thursday?
Carmelitas.
Is it every Thursday? They have Sip and Shop.
Every Thursday?
Every Thursday, I think. I might be
Sip
wrong.
and Shop.
Sip and Shop.
If you want to know more information about that, reach out to them.
Reach out to
Main Street
reach out to
Merchants.
reach out to
The
them.
bike shop.
The Bike Shop. Carmelitas. Great tamales. Go check them out there in downtown Conroe. All the great vendors in downtown Conroe. Just walk the street. Park your car, find a spot, and walk
And
the street.
walk. Cannot tell you how important it is to walk. You
Hey,
will appreciate it.
Vernelli's, New Orleans,
how did we forget
Louis.
Vernelli's?
I don't know. Vernelli's great.
Flourish.
Flourish, Gallivant,
The Omen Theater.
Break Room Bagels, Crying Theaters.
Crying Theater.
What you got?
Why are you crying?
What you got? What you got?
What else?
What else you got?
You tell me.
You tell
Wood
me.
Forest Bank.
Wells Fargo Bank, Walgreen,
Sonic.
B&S Pawn Shop.
Coming soon, the table at Maidley.
Big shout out to Frank Jackson.
Shout out.
Who else you got? Mayor Jody.
What about Maidley? MHW Properties.
Councilman Yancey.
We don't. What does he do?
He's a councilman.
Concrete.
Who else you got?
I'm winning.
Councilman Porter.
Why
I mean,
you just
Councilwoman
naming
Porter.
Porters?
I'm naming all the people in Conroe.
You thought we were naming businesses. in
We are.
Conroe.
They're all business owners too, I believe.
What business did you name the business that Marcia Porter owns?
She was a coach in Conroe High School.
What's she do now?
She helped with
Talking to the mic.
she helps with progress of the city. She doesn't. She do.
But
she
what
do a
is
lot of
her
big
business
things.
in downtown Conroe?
Look, she's
Outside of being a councilwoman?
Look at her. Look at her. She's a great woman. Okay,
Listen
she
here,
does
I'm just
a lot
saying,
of great things.
you challenge me to something, and I'm just pointing out the particulars. I'm in the lead.
Look at here, Heritage Park. First Thursday of every month, free concert. Bam.
Bam. Okay, you got some catching up to do. Keep going.
Nah, that's all right. What you
Pacific
got?
Yard House.
I said that
You did
Pacific Yard.
not.
I did. I
You
did
did
say
not.
Pacific Yard House. Watch. 150,000 push-up if you hear me.
150,000 push-ups.
Yep.
What about just like 1,000 push-ups?
1,005 push-ups.
Fine.
Who else you got?
Yard House.
Ooh, the antique
Nope,
shop.
nope.
Sorry.
Mimi's all Maine. Bam.
I just said that.
No, you can't.
I said
no,
antique.
No, there's a lot of antique shops.
Unbelievable. You are so rude.
I'm winning. Okay. I'm winning.
Lake Conroe Automotive. Downtown.
Not downtown.
Yes, it is.
Not downtown.
Downtown district. I'm sorry,
Not
you, bro.
downtown.
I can open up a map
It's
right
not
now and show
downtown.
you.
It's not downtown.
Okay, I'm gonna show you something. Okay.
No phones during the show.
Downtown district, Lake Conroe Automotive. Big shout out to Collision Solution, downtown district. Oh.
Collision Solution. Yes.
I just said that.
Ooh.
What else you got? What else you got?
What else you got?
Hey, all I know is that we got a lot of great things going on in Conroe.
There's a lot of great
guys.
things going on
Hey,
downtown
a
Conroe.
lot of businesses coming up in Conroe. We are catching up to a lot of great things. Okay, so if you looking to move to Conroe, oh, you know what I've been noticing? I've been noticing a lot of Michigander. So let me give a big shout out to all my Michigan folks that's moving to Conroe. Hey, welcome aboard. I'm from Michigan. I've been here since 2009, and I tell you what, I welcome you here to Conroe.
Hello,
Welcome to
Michiganders.
Conroe. And hey, let me tell you this too. Drop the negativity. Not everybody is bad out there in Conroe, okay? No matter where you move to, no matter where you go, you're going to always have bad apples. But I'm going to tell you something from personal experience. Everybody's great here. And just only a few bad apples.
That's very true. There's only a few bad apples. Everybody drop the stigma. Peace, love, tranquility within our city. All right, we got a great guest coming in today.
We do. He is a FNP. FNP B.C.
What does that stand for?
Family Nurse Practitioner Board Certified.
That's
Back
right.
and pain spinal bam.
Back in pain, spinal bam.
Yes, I'm real good today.
Everybody, we'll be back. Thank you so much. We have a great guest coming up. This is YPC's Young Professionals of Conroe. Talk to you soon.
Yeah.